The Arizona Medical Board minutes for the August 10th meeting are as follows. Complaint SK spoke during the call to the public. Dr. Jenkins expressed concerns regarding Dr. Maxwell's use of esmolol in this case, and she questioned whether hypertension was documented in the patient's emergency room record. Dr. Bethesda, MD, medical consultant, summarized that Dr. Maxwell states in his response letter that he examined the patient's blood pressure but did not document it. Dr. Thrift states he found that Dr. Maxwell adequately documented his reasoning for the esmolol for the patient's hypertension. Dr. Bethesda states that he questioned whether Dr. Maxwell reviewed the addendum report. Dr. Bethesda states that Dr. Maxwell did perform an epi-aortic cardiogram to determine whether the finding was true dissection. Dr. Jenkins questioned why the esmolol was administered when there was no evidence of hypertension documented in the chart. Dr. Bethesda explained that the dissection required the physician to decrease the left ventricular function with a beta blocker medication such as esmolol. Dr. Kira states he observed that Dr. Maxwell was faced with a difficult and emergent situation in which he did what he thought was best for the patient. Dr. Kira states that had the patient developed hypotension, the medication could have been adjusted. Dr. Kira moved to uphold the dismissal. Dr. Krishna questioned whether the addendum report showed that there was no dissection present. Dr. Bethesda states that the addendum did show that there was no dissection and was written prior to surgery. However, he states that the report was signed off 21 days after the operation. The board voted to uphold the dismissal of Dr. Michael C. Maxwell, MD. If after completing its investigation, the board finds that the information provided pursuant to subsection A of this section is not sufficient seriousness to merit disciplinary action against the license of the doctor, the board or a board committee may take any of the following actions. Dismiss if, in the opinion of the board, the information is without merit.
The best deterrent to medical mistakes and errors is the sunlight of information.
After the Arizona Medical Board dismissed the case against Dr. Michael Maxwell, I filed a complaint with the Arizona Ombudsman's Office. I am issuing this complaint against the Arizona Medical Board. My case against Dr. Michael Maxwell was dismissed on August 10, 2011. I received a letter that this was final and is not an appealable action. The case was dismissed based on Dr. Maxwell's answers to 3 questions. Question 1. Where did you get the hypertensive reading for my blood pressure? He answered from the monitors. On pages 799 and 801 of the medical records shows that I had no monitors on at the time of question. My blood pressure was running low, so they checked it manually until the time they took me into surgery. Question number 2. Why did you give her esmolol? Answer. It's standard practice to give some sort of beta blocker before performing heart surgery. He chose esmolol. This is true that beta blockers help with heart surgery. However, he did not document that. On page 2 of 814, Dr. Maxwell states blood pressure down to 150s with esmolol drip. On page 698 of 814, Dr. Maxwell wrote, requiring massive doses of esmolol for blood pressure control. Nowhere in the medical record or operator report did he state using esmolol for heart surgery. Question 3. Was he aware of the addendum changing the diagnosis to pulsation artifact rather than dissection and recommending more tests? The addendum was discussed with and faxed to the ED attending. His answer was no. He signed off on it 21 days later. He was the only doctor attending to me at the time, so what doctor did they speak with? Dr. Maxwell states that if he had done an MRI and it came back negative, he probably would not believe it. He dictated erroneous information in my medical record and passed this erroneous information down to other healthcare providers. On page 700 of 814, Dr. Ramina Jaju dictated that I was found to be very hypertensive. On page 698 of 814, Dr. Thaddeus O'Connor dictated elevated blood pressure requiring massive doses of esmolol for blood pressure control. The attending physician, Dr. Maxwell. Now he has given erroneous information to the board and they believe it without researching the medical record. There is no way that Dr. Maxwell should be allowed to get away with performing heart surgery on a patient with no history or symptoms of a heart problem. He told me he made a mistake. There's nothing wrong with my heart. Only after performing heart surgery. Dr. Maxwell dictated erroneous information in my chart with symptoms consistent with his diagnosis of aortic dissection. I feel saddened that the chance of this happening to another human being is highly likely. Dr. Michael Maxwell has violated the standard of care by subjecting me to unnecessary surgery, pain, and risk of death.
Best deterrent to medical mistakes and errors is the sunlight of information.
So when it's all said and done, I got a life filled with pain, doctors, and drugs.
Now finally, many in this chamber, particularly on the Republican side of the aisle, have long insisted that reforming our medical malpractice laws can help bring down the costs of health care.
You got the bill. The American taxpayers is paying for this. Medicaid is paying for this. And what did they get? Well,
you know, there have been reports just over the last couple of days of insurance companies making record profits. Right now, at a time when everybody's getting hammered, they're making record profits and premiums are going up.
so the simplest things that healthy people, like I used to be, take for granted are now very difficult. I have a 9-inch scar down the middle of my chest that is a daily reminder of the day my life changed. At 41 years old, I should be in the prime of my life, bringing the wisdom and experience of living to my work, family, and community. I still try to do that, but the truth is, my entire life is scheduled around my pain. I cannot lift or hold my children. I cannot drive without pain. I cannot work without pain. Often I cannot eat because the pain takes away my appetite. My most recent trip to the hospital was just a few weeks ago, November 21st of 2011, for inflammation and severe pain due to the surgery almost 2 years ago. There is a long list of cannots, but if all I wanted to do is dwell there, my quality of life would be even more compromised. I am a fighter. I am fighting here not only for myself to be heard and to be compensated for the grisly aftermath of a mistake, but I am fighting for the many others who suffer quietly because they were injured by the healthcare system.
This is something